great. It is 10 o'clock, so we will start today's presentation. Today's topic is current trends on e-cigarettes in youth. So before we get started today, we just wanted to go over a few housekeeping items. We are so thrilled to have so many of our current members joining us today, but for those who may not be a member yet or are interested in learning more, we are the Wisconsin Cancer Collaborative, and we are a statewide coalition of 140 organizations working together to reduce the burden for cancer for everyone in Wisconsin. Membership is free to join, and if you are interested, you can do so at that link below. So here's the agenda for today's call. We're going to do a brief welcome, and then we are going to hear from Wendy VanderZanden, who is the Executive Director of Community Action for Healthy Living. At the end, we will have time for questions. And so November is a big month for all things around tobacco and lung health. So November is actually Lung Cancer Awareness Month. And also in November, on November 18th is the Great American Smokeout. If you are interested in attending some different events on the 18th, if you check out our member events calendar, there is a whole list of different webinars and trainings going on. And if you also take a look at our social media this month, you will see a number of different posts around Lung Cancer Awareness Month that you can feel free to share to your own pages. And now I am so thrilled to welcome Wendy VanderZanden to our webinar today. She is the Executive Director of Community Action for Healthy Living and has been working in tobacco prevention and control for over 10 years. I will hand it over to Wendy now.
Great, thanks, Alex. Like Alex said, Wendy VanderZanden, actually coming in January will be my 15th year in tobacco prevention and control. So I am really excited to be here and to have served tobacco prevention that long. However, I told Alex that I haven't done an actual really professional presentation since probably, the pandemic started. So I'm a little nervous. So hopefully this goes well. I just also wanted to give a quick shout out to our veterans. Happy Veterans Day, everyone. Thank you to all the men and women on this webinar who have served or are currently on active duty. I appreciate all of your service. So happy Veterans Day. And of course, thank you to the Wisconsin Cancer Collaborative for having me today. Tobacco use is the sole culprit of much cancer throughout the state and nation. And cancer caused by tobacco truly is preventable. If there was no such thing as tobacco, there wouldn't be a cancer caused by tobacco. So keeping that in mind, we're today going to talk about the data that surrounds youth around tobacco in Wisconsin, share how tobacco has changed in the last many years, and discuss policy options and offer up ways people can take action. And of course, taking a look at health equity and how it surrounds tobacco prevention and control. Much of our work surrounds health equity. Tobacco has serious effects on the health of its users. In fact, tobacco use remains the leading cause of preventable death and disease in the United States and contributes to more than 480,000 deaths each year. Looking at the picture on the slide, you see it's clear that tobacco has completely changed over the years. All of the items you see here are tobacco products and deliver nicotine to its users. Much different from the cigarettes we grew up with. And it leads me to believe the statistics I mentioned earlier related to death and disease won't be decreasing anytime soon. If we could go, just a quick note on this. All of the tobacco that I'll be referencing today is for commercial tobacco. The tobacco that is used in traditional Native American and American Indian communities is sacred and not the tobacco we'll be discussing today. Next slide, please. Here we go. So this data that we see here is from the Youth Tobacco Survey. It's a survey of Wisconsin high schoolers, and it's collected every 2 years. However, the data we're looking at today is from 2018, pre-COVID. The state had plans to be in the field collecting data in 2020. However, COVID had other plans. The state does plan to be back in the field in 2022 to continue collecting new youth tobacco data. I think it'll be exciting and terrifying to see what the data reveals. As you can see from the chart here, e-cigarettes use has surpassed conventional cigarettes among Wisconsin youth by a lot. Probably 5-6 years ago, that 4.7% of youth using conventional cigarettes was a huge win for the state tobacco prevention and control program, as well as all local coalitions. Many years of policy and prevention decreased these numbers to that rate of 4.7. And when e-cigarettes hit the market, the giant increase we've seen, and I would even bet the numbers we see in new data, especially our youth risk behavior surveys locally and statewide youth tobacco data, I'm going to assume that number 20.1 is going to be much higher with the new data. Since the late 1990s, Wisconsin has invested in Wisconsin tobacco prevention and control for consistent, coordinated, and comprehensive efforts, which focus on prevention, cessation, local and statewide policy. When we think about policy, think tobacco taxes and smoke-free air law, media campaigns, youth access programs, and all of that led to this dramatic decrease in tobacco use. However, when we saw e-cigarettes hit the market, we saw a shift and an uprooting of the decades of work we have put in. E-cigarette use became an epidemic. It's still considered an epidemic. And the result of the epidemic was a whole new generation addicted to nicotine. You can go to the next slide, please. If we dig a little bit deeper into the data we saw on the last slide, we will see a lot of telling trends about the age of initiation. Most people who are using e-cigarettes and nicotine products now started before the age 16, and dual use of e-cigarettes and conventional cigarettes, and the impact of flavored tobacco on initiation of use, especially the use of menthol. So with the increase of availability and access and flavors, especially products that are minty, have really contributed to the increase of nicotine use amongst youth. Research shows that the minty flavors and the menthol makes tobacco more appealing to youth. It's easier to use and it's tougher to quit. It's also one of the main tactics the tobacco industry uses and has historically used to target youth and young people, especially communities of color. Next slide, please. The 4 out of 5 kids who have used tobacco have tried the flavor product first. We think about how did we get here? And there's 3 ways when looking at prevention efforts as to where we can pinpoint this happened. There's a major loophole in our laws. Flavors, packaging, placement of e-cigarettes were not regulated with the same laws current commercial tobacco is. We'll start talking about flavors and how that became big. Flavored cigarettes were banned in the United States in 2009. So cigarettes, the main word there is cigarettes. Cigars were not included in that, or chewing tobacco. A big loophole, which that flavor restriction, it didn't apply to other tobacco products, and that includes e-cigarettes. As of a few years ago, research identified that there was about 15,000 unique flavors added to tobacco products, and many of those were from e-cigarettes. Flavored products, no matter how good they smell and taste, are absolutely not safe. Very confusing for kids. Candy flavors like strawberry, fresh mint, and cotton candy give the impression that the flavored e-cigarettes, little cigars, cigarillos, and smokeless products are safer or milder versions of conventional tobacco, but no tobacco product is safe. Sweet and minty flavors merely mask tobacco's chemicals and harsh taste. So it's not surprising when we find out 4 out of 5 kids who've used tobacco tried a flavored product first. The statistics and surveys show that most kids who've tried a tobacco flavored product sometimes didn't even know that nicotine was also in those products. The next slide, please. Now we're going to talk a little bit about packaging. Again, everything on that screen in this slide is tobacco products or ways youth use tobacco or are able to hide their e-cigarette use. Bright colors, you'll see slick packaging, look-alike designs. Today, deceptive packaging makes the average tobacco product look more like candy or electronics, highlighters, or even clothing than a dangerous addiction. The sweatshirt that you see on the right of the slide, the strings that are there are actually connected inside of the sweatshirt to an e-cigarette. And when you put the string in your mouth, you're just chewing on your string. You can also get nicotine and vape through the strings of a sweatshirt. There's many other designs that exist like this, and youth can use them to easily hide e-cigarettes or vaping in schools or around their parents. What to look for in some of these packaging is, of course, the hoodies, backpacks, smartwatches, and other wearables where nicotine is easily delivered through those wearables. Shiny cigar packaging that looks like candy. There's not a picture on here of that, but Swisher Sweets. Oh, actually on the bottom, the orange piece, the orange, that's a cigar. It's wrapped in a bright orange paper, likely orange flavored. Colorful dip and snooze tins that look like mints or gum. Disposable e-cigarettes that look like highlighters or USB drives. Many of them are pictured here. Vapes disguised as everyday objects like makeup compacts. And many others. You can see there's a toothpick that's a nicotine toothpick and many flavors pictured as well there. The upper left one is kind of a famous one in tobacco control. It's called unicorn poop. Again, a flavor that's highly marketable to kids who like candy. Next slide, please. The tobacco industry uses every marketing opportunity to make tobacco products more attractive, more accessible, and more affordable for young people. That means upping the number of tobacco products and advertising where young people shop and placing their products and promotions where youth see them. But that's not all. Each number on the screen here on this slide shows the way these products are advertised and made accessible to young people. So where the number 1 is, advertising low prices and promotions. If you haven't been in a gas station recently, I highly suggest going in, especially after hearing this presentation today, to kind of look around and see how this is advertised. And now that you'll know what some of these new tobacco products look like, finding them in a retail establishment, you'll be shocked as to where they're located and how accessible they are. Price promotions, very widely used at gas stations. There's, it's on the gas pump. Sometimes it's on the signs. When you're pulling up to a gas station, sometimes it's on their big marquee, on the doors, on the walls of the gas station. And when you walk in, there's definitely more price promotions. Those are probably the easiest ones to spot. And you don't even need to go in to see those. They're all over the outside of gas stations. They make, in the second one, they make it look like candy. So packaging, flavors, also placement in the gas station. A lot of times it's above the candy, near the candy. And if it's not regulated as a product that needs to be behind the counter, you may even find that in the aisles where candy is located in gas stations. The third one, self-service displays. I always thought of the way I think about these and realize that they're there. A lot of times a gas station has, or a convenience store has lighters in a self-service place. If you look harder than beyond the lighters, you'll find tobacco products in self-service places as well. The fourth one, sell at young people's eye levels. A lot of times you'll notice tobacco products being sold not at adult eye level where they should be, but where young kids can see them. And it becomes something they see every day. It becomes more of a normal thing to see in their environment. To a lot of times, tobacco products in gas stations and industry influence, gas stations that are in convenience stores that are close to a school may have more advertising in them, more easily accessible tobacco products for youth to take with them, try to buy, sometimes steal. And there's a lot being done in convenience stores with the state tobacco prevention and control program. We've done scans just to kind of highlight these areas as to where we're seeing tobacco products being sold like this, just as to get a feel for where we're at in the state and be able to give that data to our coalition members and community members. But Wisconsin Wins is a statewide compliance program that works year-round to ensure limited access to tobacco products for youth. Every retailer who has a tobacco license or sells tobacco, including e-cigarettes, are subject to a compliance check led by local law enforcement, coalitions, and youth. In 2019, the Wisconsin statewide non-compliance rate was 5.8%. This means that 94% of our retailers are compliant with youth access laws and do not sell tobacco to minors. As most things, COVID created a standstill for these compliance checks. So the most recent data we have is also from 2019. Hopefully in 2022, we'll be able to collect a lot more youth access data as well. Next slide, please. So why is all of this a great concern? You know, the result of unethical tobacco tactics is resulting in a whole new generation addicted to nicotine. Nicotine, the addictive substance in tobacco, alters the adolescent brain, may cause memory and attention problems, and increase the risk of depression. Since 90% of current adult tobacco users started before the age of 18, this is particularly troubling. When we work with schools, we often hear that kids' stress levels are higher than ever. The pressure to achieve is at a maximum, and kids are looking for outlets. And sometimes that outlet is nicotine use. And after a few uses, they are finding themselves very addicted and doing anything they can to get their nicotine fix throughout the day at school. Likely why sweatshirts and other wearables have been adapted to be able to get e-cigarette in nicotine. Imagine feeling all the pressure and stress to succeed in academic, sports, and other extracurricular activities, only to also have nicotine withdrawal on top of it. Withdrawal of nicotine often looks like anxiety. So instead of a substance they thought would help them, is now another cause of the feelings they were trying to combat. Next slide, please. But the good news is we have been working hard to support the kids who have realized it became an addictive substance for them, and are adapting adult cessation programs to be very youth usable. A lot of times from local schools, they have seen a lot of use. They're finding e-cigarettes, they're finding kids using, and instead of punishing, they're looking to support these kids. And they're not alone. Many schools in our area have asked this question. Since there are tens of thousands of youth addicted to nicotine in Wisconsin, and many we know want to quit, we need to find ways to reach them best with cessation services. We also know no two teens are the same. They all need different kinds of help to quit commercial tobacco and nicotine products. With that in mind, the state recommends and funds the comprehensive approach when funding youth cessation programs. Each program includes a different engagement method: in-person, phone, text, web-based, whatever works best for them, to reach a broader youth audience. Some local schools allow students to do nicotine withdrawal programs and cessation programs right at the school. So that is a positive thing that's happening. Next slide, please. One of the cessation services included is the Wisconsin Tobacco Quit Line. If you've heard of the Wisconsin Tobacco Quit Line, which many of you probably have, it is a free service to help people quit smoking, vaping, or other tobacco use. This service is 24/7, always available, and open to any Wisconsin student who is at least 13 years old. And since the e-cigarette epidemic, the Wisconsin Tobacco Quit Line has done a lot of work to adjust their services to accommodate youth as young as 13 years old. Next slide, please. The Wisconsin Tobacco Quit Line service provider, Optum, has launched a new program to address the teen vaping epidemic. With the support of Wisconsin Tobacco Prevention and Control, it is coming to Wisconsin. This program is called Live Vape Free, and it offers a teen-focused program for cessation services, as well as a program for parents, caregivers, and advocates for teens, all to help them quit and use resources provided to them. The adult program is a web-based learning experience with chat and phone support that is designed to provide adults with structured actions to help teens quit and how to help them build a quit plan, to stay quit, and more. The URL for this is dhs.wisconsin.gov/vape-free. If you go to that website, and I don't know if Alex wants to pop it in the chat, there's 2 flyers available there to promote the vape-free service through Wisconsin DHS. Next slide, please. Another way to do it is to text vape free to 873373. This is a teen program. It's interactive and it's texting only. Ages 13 to 17. The price is free. You get unlimited personal assistance, which is huge. Some quit lines only offer a few service calls. This is unlimited. Multimedia experience, videos, quizzes, podcasts, and activities keeps teens engaged. There's an option to text live with a quit coach. And again, to access the vape line is right there. And of course, we can put that in the chat as well. There is something you can do. First step, if you're on this webinar because you care and want to learn more. Second step is to do something. We'll talk next about specific policies that can greatly impact current youth use rates and reverse the deadly trend of e-cigarettes. So next slide, please. If tobacco is changing, of course, we need to keep up with that and take action. Many of our current state tobacco laws refer to conventional cigarettes only. And we have learned a lot about how quickly and efficiently the tobacco industry adapts their products to continue to addict people to their deadly cancer-causing products. The tobacco industry never packs their bags, leaves, and gives up. We need to, as tobacco advocates, we need to stay a step ahead of them, which is very difficult if we compare state prevention money to the money the industry has. FDA, there's a few loopholes in our current laws, and some of those have to do with the FDA regulation. In 2009, flavored cigarettes, again, just cigarettes that are bought in a pack, were banned. But flavored tobacco products quickly adapted and took on new shapes and styles and to not be considered e-cigarettes anymore. Cigars, cigarillos are a good example of those. In 2020, federal flavored e-cigarette restriction limited sweet candy flavors in only certain kind of e-cigarettes, think Juul. The popularity of alternatives like flavored disposable vapes and sweet e-cigarette juices used in refillable devices soared. Those refillable devices and liquid you buy not already in an e-cigarette, but are ones that you can use to refill, those were not included in that 2020 federal flavor restriction ban. Puff Bar and Sorin are really good examples of those e-cigarettes that were refillable that soared after Juul had the flavors in Juul were banned. Meanwhile, the use of menthol, a minty flavor that research shows makes tobacco products easier to start and harder to quit, hasn't been restricted by the FDA at all. Menthol's cooling, cessation, and minty flavors make tobacco products easier to use and harder to quit. That's a deadly combination in communities of color, where tobacco companies spend millions to keep African-American menthol tobacco users hooked. Concept flavors. These are new and they're vague, non-characterizing descriptions on packaging. So they don't necessarily refer to flavors, so they can get through this as well. One flavor is called marigold. Formerly it was called icy mango. So because it was a flavor that was specific to candy, Arctic mint freeze, and solar is now called, solar is berry blast, among others. So just making the names different and non-food related has created this loophole. Concept flavors pose a challenge for enforcement of this flavored tobacco products. And their restrictions. They make it difficult for enforcement agencies to determine whether a tobacco product meets the legal definition of a flavored tobacco product. New products to look out for beyond e-cigarettes is I can never say this right. IQOS. It's a tobacco heating system. IQOS, I think it is, that uses tobacco wrapped in a special paper to deliver nicotine. So it kind of looks exactly like a cigarette. You put it in this IQOS system and it heats the tobacco up inside, and nicotine is released with other tobacco components and flavors for the users to then inhale. So it's not on fire anymore. It's more of a heated nicotine delivery system. Synthetic and tobacco-free nicotine products are also on the rise. These are newer products that have not been through the required regulatory review and approval processes. They also come in flavors that are proven to attract youth. Some synthetic nicotine or tobacco-free nicotine products are puff bars. They mimic the massive popular Juul and is a copycat of e-cigarette devices, but they're designed for one-time use. They come in many youth appealing flavors, including OMG, which stands for orange, mango, and guava. But again, using the OMG as a popular term amongst youth. They're not subject to new federal policy regulating flavored e-cigarettes, and that's because they are disposable. One of the many exemptions and loopholes in this new policy only restricts flavors for closed system e-liquid cartridges like Juul in its pods, but it does not apply again to the refillable cartridges or disposable products. There's also tobacco-free nicotine Zion. It's a smoke-free nicotine pouch. I'm laughing because last night, one of our friends came over and was trying to help her brother stop nicotine products. And this word came up, Zion. And I laughed because yesterday when I was looking through this presentation, I came across that and I hadn't heard of it. So when I Googled it, I was like, oh, wow, there is a lot of information out there. And then last night I had a big discussion with one of my friends about it. So it's definitely out there. And Velo, it's a nicotine pouch, very similar to pouches like snus, but it's nicotine and doesn't have any tobacco products in it. There's also tobacco pouches. There's no tobacco and considered no nicotine. And they have flavors like spearmint, where it's just a bunch of spearmint leaves that can also be used as a cessation product with hopefully none of the horrible chemicals. Current policy that is happening in the state is the Tobacco 21 law. This one is currently going on right now, and it is to increase the Wisconsin age of purchase to age 21. You might be a little bit confused by that, but because the federal government passed this, oh gosh, probably 2 years ago now, that you have to be 21 to purchase nicotine products. So that was a federal law, and our state has to adopt that law to be able to enforce 21, Tobacco 21. So in Wisconsin right now, you have to be 21 to purchase tobacco. However, it's not necessarily something that it can be enforced by the state because our state hasn't adopted that law. So that is in the process, and hopefully will pass soon. And then vape shop licensing. Vape shops currently don't need a tobacco license to sell e-cigarettes or e-juice, but regulating them through a licensing procedure at the statewide level is also a policy that is currently waiting on committee votes at the Capitol. Next slide, please. Local action has been happening for many, many years. Obviously, when smoke-free air started moving, some communities were passed laws to be smoke-free before the entire state went. That is still happening. Local action is big across the state when it comes to smoke-free air laws, to include electronic smoking devices, commercial tobacco-free outdoor spaces such as parks, beaches, and event spaces are being passed across the state in municipalities. And tobacco-free school policies that include electronic smoking devices is also happening at the local level and often. Tobacco-free schools is a huge policy that we look at our local levels and work with all of our schools to make sure that they have the most up-to-date policy, so students know that these are prohibited, as well as parents. Next slide, please. Health equity has been a buzzword throughout the state and nation for many years, and we take it very seriously in tobacco control as well. The Robert Wood Johnson Foundation defines health equity like this. Health equity means that everyone has a fair and just opportunity to be healthy. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Many disparities or differences in certain populations and health are rooted in inequities in the opportunities and resources needed to be as healthy as possible. The determinants of health include living and working conditions, education, income, neighborhood characteristics, social inclusion, and medical care. An increase in opportunities to be healthier will benefit everyone, but more focus should be placed on groups that have been excluded or marginalized in the past. Data, again, pre-COVID data, shows that the US adult population smokes conventional cigarettes at about 16%. When we started looking more in depth at those numbers, we realized smoking disproportionately affects certain communities, many of those that are much in need, such as the poor, homeless, racial minorities, and those suffering from substance use disorder or have behavioral health issues. These populations have been marginalized by the tobacco industry through marketing, access, culture marketing, discounted products, which were sometimes free, and handing out cigarettes with food stamps. One of the most targeted groups is obviously young adults. Young adults are an important target for the tobacco industry, particularly because they face major changes in their lives. The industry studies young adults' attitudes, lifestyles, values, aspirations, and social patterns with a view toward making smoking socially acceptable part of a young adult's new activities. Next slide, please. So for decades, tobacco companies have specifically targeted minority communities, particularly African Americans, with intense advertising and promotional efforts. A wealth of research indicates African American neighborhoods have a disproportionate number of tobacco retailers, persuasive tobacco marketing, and in particular, more marketing of menthol products such as Newport, as you see on the slide here. Like many minority and low-income neighborhoods, African American neighborhoods tend to have more tobacco retailers, making tobacco products more accessible to their community. Next slide, please. Tobacco is just not a public health issue, it's also a social justice issue. Earlier this year, Truth, one of the most successful and one of the largest national youth tobacco prevention campaigns run by the nonprofit Truth Initiative, launched the Stop Profiling campaign as a way to shine a light on how the tobacco industry deliberately singles out the very communities that already face adversity and inequality with aggressive and unfair profiling tactics. For years, the tobacco industry has made efforts to appeal to LGBT consumers through things like targeted advertisement in the LGBT press, cigarette giveaways, and free industry merchandise at events and festivals. And today, the LGBT community is among the most hardest hit by tobacco products. So the examples that you see on the slide are just a few of the many, many examples that the tobacco industry uses to target and market these products to LGBT communities. The words they use are buzzwords in those communities, like pride. There's rainbows, as you can see on the camel advertisement in the middle. So just a good example here about how they're doing specific marketing to certain populations. And it works. We know these populations they advertise directly to have higher smoking rates than the average adult population. Next slide, please. So thinking about what our role is as local advocates. Educational advocacy, some examples of that are providing legislators and stakeholders with education on best practice policies that lead to system level change, organizing community events to educate communities on products that are marketed within those communities and to who, giving presentations, providing public testimony to local or state decision makers, and writing letters to the editor, such as press releases. Many of our media goes out as letters to the editor and press releases, and a lot of local media is that we send out is tailored to the e-cigarette epidemic, as well as the ways that we can educate our community on the products that are currently available. And then we always want to ensure that health equity is a top priority in our press releases, in our media, in all of our presentations. Next slide, please. So if statewide, if you're wondering how to get involved, there's a lot of ways. There's local coalitions, as you can see across this map, in all of the counties. The gray ones don't have a specific coalition that's in those communities. However, there is technical assistance that you can get statewide if you reside in one of those counties or are looking for prevention or educational efforts within those communities. Fact groups, I haven't touched much on fact groups, but that is youth groups that are across the state. FACT is a youth specific group. It's youth led. They do advocacy around tobacco industry tactics and prevention level efforts within their schools. Most TPCP alliances that are listed in that are in blue have FACT groups that are working hard across the state to prevent youth from ever starting tobacco use and sharing some of the tobacco industry tactics that I've talked about, as well as health equity at the youth high school level. Next slide, please. And the tobaccoischanging.com is an effort that is statewide through DHS. If you go to tobaccoischanging.com, it's focused for parents and professionals to describe the different tobacco products that are out there, how to talk to your kids about them, and what to look for. And I always like the slide. Here's hoping your kid hates sweets, because you probably can't find a kid who really hates sweets, especially candy flavors. So educating parents on what that looks like, what exists, and how to talk to your teens about them and the addictive properties of these tobacco products and nicotine is a good resource. Tobaccoischanging.com. Next slide, please. Any questions for me? I would like to have an open conversation about what you're seeing locally, as well as any specific questions related to what I've talked about. I'd be happy if there's any questions now. Alex, if you could let me know.
Yeah, thank you so much, Wendy. That was really great to see, because I feel like every time I see a presentation or read a flyer, there's just new things popping up all of the time. So if anybody has any questions, feel free to drop them in the chat box now, or even unmute your line and feel free to ask. Wendy, when you were presenting right away, one thing that came to mind is when you were talking about the puff bars and how they're single use. I was curious if you get any environmental groups interested in working on this issue, because the single use seems like it's probably creating a lot of different waste products.
Yes, yes, especially with battery operated. There's a lot of information that we're just starting to get about disposal of these products. Environmentally, the single use and disposable is probably going to be another big environmental issue. We started working with Network Health. It was a insurance agency, and one of their big things they wanted to share in their community was disposal and have disposal sites and disposal drop-offs. I know that also doTERRA packs, the packs that are used to disintegrate medicine, e-cigarettes can also be disposed in those, but getting your hands on multiple doTERRA might not be easy. So there are resources, Alex, that do currently exist. I'd be happy to get those to you so you can send them out. Oh, you're muted, Alex.
I'm on mute. Thank you, Wendy. We have another question that just came in that asks, it seems like a lot of this falls onto the parent. How can we, or are we engaging other adults that touch our youth, like coaches, teachers, counselors?
Yeah, that is a good question. I can only answer locally for our organization. Our organization, Community Action for Healthy Living, we're located in Kaukauna, and we serve, for tobacco control, we serve Outagamie, Calumet, Wapaka, and Brown counties. So I'm going to answer that question as to what we do locally. But again, the alliances that I showed in the last slide, if you want to know what's happening locally in your communities, you could reach out to one of the coordinators. But we work closely with our school districts. One thing that we've done we always send out back to school packets with lots of information for coaches, for teachers, for administration, with a quit line stuff has kind of been a big thing for us, just because we know that kids are using, we know kids are being caught. And when they are unable to engage with the school nurse or an administrator or a coach, we want to make sure that the people that are talking to these youth that have been caught have the resources they need to have an engaging conversation with them. And whether that's about quitting, they have those resources available. Also, we work closely with our school districts, providing education to teachers. During the pandemic, those presentations, of course, in person went away. Our organization developed quick videos that we were able to send out to schools in newsletters. And if it was administrative supported, a lot of times teachers were giving hours of education to be able to view those presentations. We were lucky, our coalition has been established for a very long time. I, of course, have been with the organization for 15 years. So those relationships and partnerships have been ingrained for a long time. So just getting phone calls, making personal phone calls, making sure people have the resources that they need, especially when it came to, these are new products that are out. Let's make sure people understand what they look like and what they are, and that they are a nicotine delivery system. And then, of course, we always tell your students are your best contacts for what's going on in your school. So looking at leadership groups that exist and talking to them about what they see at their schools, and providing even teens the role of, I don't want to say telling on kids, but educating the adults as to what's happening in their school systems, and then having us partner with them to get them the resources that they need to effectively deal with what's happening at the school level. Did that answer that question?
Great. That was a great answer. Thank you for that. Another question that just I've been wondering about too. I know you said that we don't have the current data for what the e-cigarette use trends look like for over the pandemic, but I was curious if you had any thoughts, or if just heard from what your work is in the community about what you think those rates are going to look like when the state is able to get back into the school and start doing some surveys again, because I know for the first time in many, many years, we saw the use of conventional cigarettes go up. I was curious if you had any thoughts on what that's going to look like for our youth.
Yeah, and that's such a difficult question to answer. And I've heard both sides of it, right? Like with students being home during the pandemic and doing schooling from home, we've heard that e-cigarette use went down because they weren't around their peers and they weren't being pressured to use by their peers, or if their peer was the one who was pressuring them to use and that was kind of taken away, that e-cigarette use went down. However, I've also heard the exact opposite, especially from schools and leaders in the community that work directly with youth, is that it's worse than ever. And that teens are being caught not only with nicotine vaping devices, but also THC devices, and how schools are dealing with the uptick of being in school, dealing with all the stressors of school and the pandemic on top of it. Some people believe, and again, this is what I've just been hearing in our community, so these aren't necessarily facts as to what's happening, and we won't know that until we're able to get the data back. But that with the stressors of the pandemic and the anxiety, that e-cigarette use has skyrocketed, and they're finding it more than ever, and kids are using in schools more than they've used before, and they're being caught, and schools are having to try to regulate bathroom use for kids, just because the e-cigarette usage has been so high. We have gotten a few emergency calls from our school districts. What can we do? Holy crap, this is, we have caught more kids in the first month than we caught all year last year. So we've been working closely with some of the programs on, because based on school policy, sometimes that can be a suspension, how to get kids, if they have been caught, a non-punitive punishment where they're able to take a class either through the American Lung Association. There's multiple offerings. One of those programs is in depth, where they learn a lot about the industry and the target and how to quit and making a quit plan. So we use our partners programs to offer up to the schools as well.
Thanks, Wendy.
Sure.
It looks like we have another question that came in that said, are there rules for showing vaping and e-cigarettes in videos, movies, TV shows rated for kids, like there are for regular cigarettes, or is this another loophole again?
Wow, that's a good question. I haven't thought about that. I'm not sure. I'll have to get back to you on that, but I am going to assume that it's conventional cigarettes. But again, I'll look up that, or if anybody on this call, I know there's a lot of people that are maybe tobacco control or familiar with tobacco control advocacy. If anyone knows that answer, if you could pop that in the chat, that would be awesome.
Any other last questions for Wendy? I see Courtney has raised her hand, so if you want to go ahead and unmute your line, feel free to.
Yeah, can you hear me?
Yes.
Okay, great. I was just wondering, I think, Wendy, you mentioned that there was a law passed that for conventional tobacco, that flavors they could not do flavors anymore, but there still is menthol, right?
Yep.
Is that right? Of cigarette?
Yes, yes.
So does that right. not fall under flavors, or?
Nope, that was considered not a flavor. They restricted when they passed that, unfortunately.
Oh, okay.
I mean, yeah.
Yeah.
Yeah, so menthol.
Thank you. I was just curious about that.
Yeah, you're welcome. And even now, when they passed the flavor ban for products like Juul, because Juul had flavors like mango and mint, and they had mint and menthol and like cucumber. Even menthol for Juul is still legal. So Juul has 2 flavors you can buy, and it is menthol and classic tobacco. So still, even those products that have current flavor bans on e-cigarettes are still able to have menthol. And we know that menthol, it is still a flavor. Kids still prefer it. It makes the product easier to use and, again, harder to quit.
Thanks, Wendy.
And I do also want to just thank quickly the Wisconsin Department of Health Services, who fund our coalition, but also helped provide some of the slides for this presentation. And on the next slide, actually, I believe is my contact information too. If you ever want help with finding local tobacco control advocates or your coalition or resources, I'd be happy to help anybody who wants to become involved.
Thank you so much, Wendy. I really appreciate you taking the time to present with us today. It was really great information.
You're welcome. Thank you for having me.
Yeah. And before we wrap up today, I just wanted to share a couple resources. So Wendy highlighted this in one of her slides, but this is a really nice one-page handout that DHS made that highlights the different cessation programs that are available for youth in the state. The link to this is right here at the bottom, but you can also find this in our resource center at our website, wicancer.org. And if you can move to the next slide, please. And if you're looking for different resources around tobacco or lung cancer, we do have a couple really great resources you can look to. We have a lung cancer infographic that illustrates cancer prevention and detection strategies in easy to understand ways. And you can also find this at our website or the link below. Next slide, please. And then we also have a lung cancer how-to sheet on ways you can help lower your risk for getting lung cancer. And again, this is a very easy to read one-page handout that is great when working in the community. Next slide, please. And we also just wanted to thank you all for such a great year in 2021. We will not be having a December webinar, but we are looking forward to seeing everybody in 2022, hopefully in person in some events. So we cannot wait. And then Tina, I don't know if we have a poll for this one today.
Sorry, multiple screens up here. Let me see if I can. Nope, I don't think there's one for today.
Okay. Well, thank you all so much for joining us this morning. I hope everybody has a wonderful rest of their day.